Hey guys, welcome back to Buying the Pharm. This is Johnny from SoCal EMS, and the medication we're going to discuss today is going to be oral glucose. So oral glucose is going to be a medication that is indicated by someone who is hypoglycemic. Signs and symptoms of your hypoglycemic patient could be altered level of consciousness, pale, cool, clammy skins, and depending on the severity, this patient could potentially be unconscious. So in order for us to understand oral glucose and its indication of hypoglycemia, we do have to break down a couple things. So I want to talk about the pancreas and the endocrine system. I want to talk a little bit about diabetes, both type 1 and type 2, and then we'll dive a little bit deeper into oral glucose itself. So the pancreas is part of the endocrine system that helps regulate the blood glucose levels of our patient. Your normal blood glucose levels typically should be between 80 and 120, and depending on whichever textbooks that you're looking at, it could be as low as 70 to as high as 140. So when we base our range for our normal blood glucose levels, we have to understand what textbook we're reading and or the protocol set that we're using. The pancreas itself, in order to regulate our blood glucose levels, if we have high blood glucose, it's going to release insulin into our system, which is then going to decrease the blood glucose level. And when our blood glucose is low, the pancreas is going to release something called glucagon, which is then going to signal the liver to release glycogen, which then gets converted into glucose to increase our blood sugar. So our pancreas is maintaining this ebb and flow of insulin and glucagon to maintain homeostasis in our body. Oftentimes, our patients who become hypoglycemic are going to be our diabetic patients. There's two main types of diabetes. We have our type 1 diabetics, generally juvenile onset diabetes, and this is about 5 to 10% of that patient population. These patients are also known as insulin-dependent diabetics. So what is happening is they have an insulin deficiency, meaning that their pancreas is either not creating any more insulin or it's not creating enough insulin in the system, so their blood glucose levels are not regulated by the pancreas. And then we have our type 2 diabetic patients. These are generally our older populations who either live sedentary lifestyles, are obese patients, or patients who have poor dietary choices. These are our non-insulin diabetics. They have something called insulin resistance, meaning that their pancreas still produces insulin, but it's just not as efficient at maintaining or stabilizing that blood glucose. There's a few ways that our patients can become hypoglycemic. So if our patient's in a hypermetabolic state, meaning that they're burning off more glucose than is available in the system, they become hypoglycemic. And or also, we can have a patient who took their insulin or took their medication for their diabetes without eating, so they don't have the glucose in their system to maintain that normal blood glucose level. Both our type 1 and type 2 diabetic patients most likely will be prescribed some form of medication to regulate their blood glucose levels. Our type 1 diabetics are generally prescribed insulin, and these could either be short, rapid, or long-acting medications to help stabilize those glucose levels. It's not uncommon for our type 1 diabetic patients to have glucose monitors and also insulin pumps. If our patients don't have insulin pumps, they can inject insulin into themselves directly. But with the advent of modern technology, the insulin pump is becoming more and more commonplace, and it's helping our patients live healthier, longer lifestyles. And then we have our type 2 diabetic patients are going to be on an anti-hyperglycemic agent, meaning that it's a medication to prevent their blood glucose from spiking or becoming high. A very common anti-hyperglycemic agent would be something along the lines of metformin. So as far as oral glucose itself, oral glucose is generally stored in 15-gram tubes. It's a simple carbohydrate designed to be eaten orally, and often it's flavored in either grape, cherry, or lemon. Typically, we are going to treat our patients for hypoglycemia. Their blood glucose levels, depending on protocol set, are generally less than 60 for adults and pediatric patients and less than 45 for our neonates. Oral glucose, meaning orally, it's designed to be swallowed, but we can administer this medication sublingually under the tongue or buccally into the gum line, which then gets absorbed into the mucosal membranes in the cheek. So as far as the SoCal EMS testing sheet, this is going to be your guys' testing sheet verbatim. Oral glucose, class, carbohydrate, dose, 1 tube, route, orally, PO, action, increases blood glucose by introducing free sugar directly into the bloodstream, onset, approximately 5 minutes, duration, dependent on the degree of hypoglycemia, indications, symptomatic hypoglycemia with blood glucose less than 80 milligrams per deciliter in adults or 70 milligrams per deciliter in pediatrics. Signs of symptomatic hypoglycemia: altered mental status, weakness, confusion, pale, cool, clammy skins. Contraindications: hyperglycemia, lack of gag reflex / inability to swallow. All right, you guys, so that was buying the Pharm for oral glucose. As always, thanks for tuning in, and we'll see you next time.